All right, let's talk about Brues, or otherwise known as brief resolved unexplained events. You may have also heard the term ALTI when talking about this. So the differential for a Brue can be huge, but we've kind of narrowed it down. So infection, trauma, heart disease, metabolic disease, neurologic disease, and respiratory disease. Predisposing conditions to having these events, if a baby has feeding difficulties already, for example, reflux disease, if they have a recent URI, they're less than 2 months of age, a history of previous episodes, if they've had a premature birth or at low birth weight, and then maternal smoking has also been a predisposing condition. So the pathophysiologic process obviously can be variable depending on what the inciting event is, but GERD can be a common cause of these events. And so what happens is the gastric contents flow retrograde up the esophagus and then down the trachea, and then they stimulate the vocal cords to snap closed. And this snapping closed causes gasping, color change, sometimes a sound, and you may see a change in tone. And so what parents don't realize is this is a normal physiologic response to this, to the contents going down the wrong way. And so this is obviously very scary. But I try to explain this as drinking water and it goes down the wrong tube. So clinical manifestations. So during these events, patients are typically described as having cyanosis or pallor, a change in tone, so they can be high tone or low tone, altered level of consciousness, and then irregular breathing. The key, though, with these events is that they return back to baseline when they come in to be assessed. What also makes these events so hard is it's usually the parents giving the description of the event, and there's not a medical person there to give a true accurate description if the parents aren't as accurate or interpret the information incorrectly. So we look at when we look at this, we look at patients who are at low risk, and then we also look for warning signs. So low risk are kids greater than 60 days of age who are born after 32 weeks gestational age or 45 weeks post-conceptional age. If the event was less than a minute, if no CPR was given by a medical provider, and then if there weren't any concerning historical or exam findings as well. Warning signs are bruising or any evidence of trauma, so then you're thinking about child abuse. If they've had previous events in the last 24 hours, that could also be concerning for something going on. If the baby's not at baseline and is toxic appearing, lethargic, or in distress, would also be a concern. If there's a history of sudden infant death syndrome in the family is also concerning. Obviously, if there's a history of abuse or if the story just does not seem to fit, or if the patient needs CPR, then those are also very concerning. So evaluation. So if the baby has returned back to normal, you may choose to do nothing and just observe and follow up accordingly. Some may also decide to get things like an EKG as well. But mainly, evaluation should be based off of the exam and what you find in your HPI. So if the baby has fever or is toxic or in respiratory distress, then you need to consider an infectious workup. If these events happen during sleep, then you might consider something like gastroesophageal reflux disease or GERD. If they're found to be hypoglycemic, acidotic, vomiting, or lethargic, think about metabolic diseases. If they have altered level of responsiveness, think about ingestions, think about trauma, think about infection, metabolic disease, neurologic disease. And then if there's cyanosis, think about heart disease. If they have an abnormal heart exam, may get an EKG or echo, that kind of thing. So overall, though, if there are concerns, they do recommend getting a baseline workup consisting of a CBC, a basic metabolic panel, urine analysis, chest x-ray, and EKG, and then you kind of broaden your evaluation based off of the findings on your exam and in your HPI. Sometimes with these events, they can be kind of scary for families. You may see them requesting home monitors, but it's been shown that in most cases, children do not need to go home on home monitors for the main concern that these don't prevent these events from happening in the future, and they just cause more stress to the family. And then remember that the overall treatment for these events are directed towards the underlying problem that caused them. And that concludes our talk.